Welcome to Wonderful Women's Wednesday, where we talk about everything women on Wednesdays. We talk about whatever it is that we think we may want to speak about in regards to women's well-being, from a time we're young ladies all the way up to being full-grown women and to menopause. Any topic that you guys feel like you may want to discuss, please let me know. If it's within my realm or my scope, I will try to give a little bit of input. I am not a physician by trade. I am a registered nurse by trade. And so I would like to keep us all updated on things that are relating women and things that we should be looking out for. Okay? Hopefully everybody has their own personal OB or a gynecologist. Your primary care physician is in place for you to be able to check out the things that are concerning our female needs. So today I want to talk about fibroids. Yeah, fibroids. Fibroids is a non-cancerous tumor that women do experience. Some women experience having mainly between the ages of 24 and 40. That's when they begin to know that they do have them. It is said that fibroids are genetic. So if you have a grandmother or a mother, or it's in your mother or father's history of the females that are in their families, then a lot of times those women are able to pass it on down to their children and grandchildren. Okay? Fibroids grow. They can be the size of a small hole punch in a hole all the way up into the size of a melon. They can be very, very painful, as they are made up of a lot of muscular and vascular materials inside the body. They can grow in, outside, and around the uterus area, inside the wombs, making it complicated for women to have children. Especially those that are childbearing years, like I said, between like the ages of 25 and 40. Those women who have complications, a lot of times they either have difficulties with childbirth, maybe children don't make it because the child is expelled before it can have a chance to grow while it's still a fetus. Okay? It's something that fibroids is something that women, we should get checked out during our exams with our OB or gynecologist. We should be getting checked out regularly. And they do check up in there to see if that is a complication that you may or may not have. So if you look at a fibroid, and it made up and its components that it's made up of, you'll see, because it is very vascular, a lot of times doctors are not so quick to always give surgery, because surgery is, even though surgeries are one of the things that will help, it consists of like a total hysterectomy at times for women. So we try to avoid those certain things, or it's tried, physicians try to avoid those hysterectomies if they can, by doing what's called an embolization or a cauterization of the actual fibroid itself. That's a burning of the fibroid, or, the main goal, just so you know, is to either shrink it or get it to disappear. Sometimes fibroids can be treated with like hormone therapy, or some medications they do give you to kind of treat the fibroids with the hope of them also shrinking. But every woman is different. Every case is different. So there's no two women or situations that are the same or alike. If you end up with a child or pregnant while you're having fibroids, whether you're pregnant or not, can be very painful. A lot of times with fibroids, what people experience is a frequent urination. They get lower abdominal discomfort, or just abdominal discomfort and pain. There could be like a pulling sensation that you may feel to let you know something's there. You'll have heavy menstrual cycles or irregular menstrual cycles. There's back pain that is associated with fibroids. There's a lot of different things that are associated with fibroids, and so that is why it's important to try to get to the physician to let them know that some of the symptoms that you may be experiencing. What they do is they use an ultrasound machine to try to see where the fibroid is. They can measure the fibroid, see exactly its location, and they can see its size. Okay. If fibroids are not treated, sometimes the hope is that they do go away, right? And like I said, a lot of women don't know that they have them, and they do shrink once somebody's hormones or estrogen levels are under control. Women that are of menopause age or older generational women that begin menopause because of the change in estrogen and hormone levels in them, the fibroids automatically shrink. If you're pregnant and once the baby is delivered, sometimes the fibroid does also shrink then as well. So again, please know that with fibroids that, please take care of your health and check into it. You don't want long-term complications, or if you're trying to conceive a child, that to be a hindrance to you growing and developing your family. You want your family to grow. You want your family to develop. So I just wanted to come on real quick and talk about that today on Women's Wednesday. If you have any questions, please see your primary care physician or your gynecologist, and they can take it from there for you, okay? And they can handle anything that you need. But don't take it lightly if you're experiencing pain or difficulties. If something ain't right or something is not right inside of you, please seek professional help. Okay? Thank you.